Hi there, this is Leslie Bumpas of Redeeming Wellness. And today we're going to talk about people don't realize what happens in your mouth doesn't necessarily stay in your mouth and the overall impact that oral health can have on general wellness. That's why a lot of people, my clients who are health conscious, are turning to dentists who are considered holistic or biological. But if you've ever wondered what sets them apart and why they choose this path, you're not alone because my personal dentist, Dr. Sarah, and I say Tevis, right? Yes,
Yes.
is here to tell us a little bit about the impacts that oral health has on our overall wellness. And that can include cardiovascular health, musculoskeletal health, brain health, dementia. I remember sitting in her chair the first time, and there was a slideshow going on about how the bugs in your mouth can cause dementia. And she actually ran a test, so we can talk about some of those tests. And specifically, I want to know what she's observed for women 45 plus as our estrogen declines and we enter perimenopause, how that impacts our mouth. So, Sarah, tell us a little bit about, have you always been a functional dentist, or was there some sort of event in your life that made you shift?
Such a good question. Thanks for having me, Leslie. This is so cool. We love having these discussions.
Yeah.
So, it's a journey. I think with any of us that are healthcare providers, we have a personal reason why we do this and why we want to
Mm-hmm.
help people, and it usually stems from ourselves or a loved one, and an eagerness to get to the root cause of what's going on in our health. So, no, I mean, a traditionally trained dentist doesn't really dig into oral systemic connections as much as, and I think that's changing. I think there's a paradigm shift going on with dental school and medical school training, but it's taking a while to get there. So a lot of this is just my dedication to digging deeper, learning more, asking why is this happening? Not just, oh, I can fix it, but what's going on?
Right.
And being more of an oral detective for my patients' health because they often see me more than they see their medical providers.
Hopefully twice a year.
And hopefully twice a year, but sometimes even more than that. And so I'm such a key person to identify early changes in their mouth that could be a red flag that there's more going on that we need to look
Right.
into.
Right.
Maybe more labs need to be run. Maybe a sleep study needs to be done. Maybe there's some nutritional deficiencies or imbalances. The mouth is just such a window to so many of those things. I think personally, I was having some health issues early on and was seeing a functional medicine provider and really determined that I had some heavy metal toxicity.
Ooh.
And my mercury and lead was off the charts. And I've
Mm.
never had an amalgam filling in my mouth ever.
Oh,
So
really?
she's like, this has to be occupational exposure. I have
Oh,
not placed amalgam fillings in my
yeah.
career, but I remove a ton of them. And it caused me to look at things differently in how I practice for
Hmm.
my own health and safety as well as my patients. So now anytime I remove amalgam fillings, I protect myself as much as possible, my team members, my patient,
Yeah.
mercury exposure. And then just advanced training in cardiovascular disease prevention, diabetes prevention, doing some advanced fellowship training, um, and all those interesting areas have really just navigated my path more to a functional medicine, functional dental approach. So my background went to UT and San Antonio for dental school, did a residency, and I've been practicing in Dallas for almost 20 years now.
Yeah. So what my team needs to know and my tribe, my audience is that when I go see Sarah, we just nerd out about all the
Yes,
latest,
yes,
coolest
I
stuff
love it.
because our practices intersect, dentistry, functional dentistry intersects with functional nutrition. And yeah, so I talk about the gut microbiome all the time, the importance of the healthy balances of our bacteria. I run stool tests a lot to determine that, food sensitivity tests. But when I talk about microbiome, I don't think people think that our mouth has a microbiome. Can you tell us a little bit about that?
Well, the mouth is a part of the digestive system.
Mm-hmm.
It is directly the first thing that starts our digestive process. As we eat food, the bacteria in our mouth start to break down that food, the enzymes that we have to break down food. And there's such an integral connection between gut health. So when people say leaky gut, I think of leaky mouth. I mean,
Ah, I like that connection.
if you have a
Yes.
leaky gut and it's going crazy, your mouth probably is too. There's such a connection between the permeability of the gut intestinal lining and
Wow.
what's going on in your mouth.
Yeah.
If you're
Leaky
having some
mouth.
food sensitivities, okay, so I see we do food sensitivity testing as well, because in the mouth there can be reactions to certain things that you're
Yeah.
eating,
Yeah.
and patients come to me like, my mouth is burning, my mouth is stinging, my mouth is on fire. Okay, it's what are you putting in your mouth? Like, what are you eating? Is your body is chronically inflamed to something.
Yeah.
Let's figure out what it is. Is there candida overgrowth going on? Is there a dry mouth going on? So, yes, getting to the root cause as to why this is happening, because it's not just brush and floss better. There's so much more to it.
How do you think, gosh, there's so much there to unpack.
I
How do
know.
you think that role of estrogen plays in, as I would know, in bone density, but more importantly, in gum health, gum, jaw, teeth health?
Well, premenopause starts so early. I mean, we're finding out that, at mid 30s, 40s, your premenopause is already starting.
Mm-hmm.
So with the decline in estrogen, bone health can suffer. And estrogen is such a critical marker for
Mm-hmm.
bone health and gum health are integral. So if you have bone loss everywhere, you have bone loss in the jaw. The jawbone supports teeth. The gum health around it supports the jawbone. So if you have gum recession, it's usually because there's bone loss associated with that.
Wow.
They go hand in hand. So bone density, bone quality, bone loss, and estrogen, I think, are so linkly tied. And women, especially TMJ type problems, so
Mm.
the temporomandibular joint,
Clicking and yeah.
women are 3 times more likely to suffer jaw pain, TMJ problems than men.
Really?
And the peak of that is, I just read a study between 45 and 64. Okay, what's going on between 45 and 64?
There you go. We lose our estrogen.
We
Hormone
lose our
shifts.
estrogen, our jawbone is suffering because of that. The joint, the hyaluronic acid in the joint isn't
Mhm.
as fresh, and um, friction starts to happen more,
Yeah.
nor more likely to suffer from chronic pain associated with that. So gosh, estrogen is so important. When we decrease our estrogen, our inflammatory proteins and those cytokines then increase. So it's this cascade of inflammation that can happen, and the mouth often suffers. And more so, what I see in my patients, I mean, I'm 49, so I'm in
Uh-huh.
that category, is a dry mouth. So the consistency of your saliva
Yeah.
is critically associated with estrogen. And when your estrogen drops, your mouth can become more dry. And then with a dry mouth, you get more plaque accumulation. Your gums will bleed easier.
Yeah.
You're more likely to get burning mouth syndrome or mouth sores or ulcers, and just what is going on.
What can we do to improve our saliva production or quality?
Hydration is key, electrolytes. I've been just like, yes, water, a pinch of really high quality sea salt and water just to
Yep.
add a little boost of electrolytes. Don't be a lemon water sipper all day,
Oh no.
because lemon, lime, fruit juices are so acidic. And
Hmm.
if you're constantly exposing your mouth to acidic foods and drinks, your pH can't keep up. And so you have a lower pH in your mouth. Things get drier, they burn easier. It's a horrible thing. So moisture, we have to add moisture to the mouth. So there are products out there that can really help balance your pH, increase moisture as saliva substitutes. Biotine
Uh-huh.
has a good line of
Oh,
products.
good. Okay.
I use a product in my office called All Day Spray, where you can just spritz your mouth. It's really
I'm
lubricating and
a believer. I
moisturizing.
love that Love that at night.
especially before bed, just to have a barrier of protection to
Mm-hmm.
hydrate your mouth, I think is important. Throughout the day, chewing gums or mints that are sugar free, that have xylitol in them. So xylitol is a very natural antibacterial, helps produce saliva production throughout the
Okay.
day.
Okay.
So popping a piece in, sucking on it, or chewing it can really pump those salivary glands throughout the day, especially after eating or snacking.
And we
So
don't think, but my concern is that even though it's calorie free or sugar free, that you're still telling the body something sweet is in the mouth. And so insulin
mhm.
goes up. No?
I don't, I'm not as concerned about that as just
Okay.
getting the mouth in a better condition.
Yeah. Yeah.
And xylitol, I don't like the products that are aspartame or sorbitol
Yeah.
or,
Yeah.
but I think xylitol is one that has been studied over and over, drops cavity rate drastically.
Okay. That's good to know.
And so kids, especially my pregnant patients, dry mouth patients, it is a really handy tool in your toolbox to keep that
Okay.
saliva pumping throughout the day.
Okay, great. So one of the tests that, and this kind of ties back to the oral microbiome that you offer in your practice was to test the bacteria in your mouth and relate it to the risk of dementia and brain issues. Tell us
Absolutely.
about that.
Okay, so if anybody's read any of Dr. Dale Bredesen's work,
And I'm trained
I
by him.
highly recommend. Yes, Leslie is a provider and his method. Alzheimer's is a multifactorial condition,
Oh,
right?
yeah.
It's
Yeah. Yeah.
terrible. I mean, there's so many components to it, but he really talks about how the mouth health is integral to brain health.
Mm-hmm.
The bacteria in our mouth, especially like PG, Porphyromonas gingivalis, that's a big word,
Yeah. I call it
travels from the
P-Ginge.
mouth. Yeah, PG travels from the mouth to the brain, can start that inflammatory process in the brain. Also, toxins that we're exposed to. So, toxins in the mouth, like mercury or dental infections, those are also things that
Mm-hmm.
are continually to can exacerbate conditions. So brain health, especially if there's a family history of dementia or Alzheimer's, it is so critical that your mouth is pristine
Yeah.
and that you try and eliminate toxins in your mouth and your body and really have ideal oral microbiome balance.
Yeah.
We can
Yeah.
test for that. That's so we're not guessing anymore. That's the beautiful
Oh,
thing.
that's wonderful. I think
Test, don't guess, test, treat, remeasure. Like it's just so empowering for our
mhm.
patients to know, okay, I have information now that I can better treat myself and hopefully offset risks that may be going on chronically.
Cool, cool, cool. So, what are the some of the best practices to support beyond just brushing and flossing? But I do have a fabulous sonic toothbrush that I love, and I have a water pick type of water flosser. I also have regular floss. What else do you recommend for a healthy mouth?
Okay, yes, you have to brush and floss. That's standard. Water pick, game changer. Like, uh, it's hard to floss. Nobody does it really well.
Yeah,
You can
yeah.
add
Get
in,
in
I
there.
mean, if you add in some kind of power washing, water picks are great, especially if you have crowns, bridges, bonded retainers, implants. Traditional floss just usually can't get there. You've got a water pick. It's amazing. You can brush and floss and then use your water pick and you still see stuff come out.
Absolutely.
Where was that
Where
hiding?
was that hiding?
So, huge game changer. My male patients love the water pick.
Oh, my
It's,
husband says it's better than you know what.
yeah. Oh, he talks to me all the time about that. Yeah. Like,
I
game
love it.
changer. So those are really good tools. An electric toothbrush, soft bristles. Beyond that, tongue scraping, big believer. You've got to clean the biofilm off your tongue.
Mm-hmm.
Bacteria lives everywhere in your mouth, tongue, tonsils, back of throat, gum tissue. So a lot of our bad breath germs live on the tongue. You've got to clean that daily. Um, Products that are hydrating, so you absolutely want to stay away from mouthwashes that have an alcohol
Isn't
content.
that interesting? Stay away from mouthwash.
So studies show that it wipes out the good bacteria and the
Oh,
bad.
yeah.
So it's like scorched earth. You can't You need the good stuff. You need to feed the good stuff. You don't want to just kill everything.
Right.
So I would really avoid your alcohol. If it burns, don't use it. Like it's
Right. Okay.
not good for you. Use more if you want to use a mouthwash, something alcohol free, more essential oil, natural base. But even those you really don't want to go crazy with, because even the essential oils can kind of shift things around a little bit that you don't want. Oral probiotics. So you want to feed the good bacteria in your mouth.
And is there
Just
such a
like,
thing as an oral probiotic? I mean, I know the answer,
absolutely.
but
I know. So absolutely, there's mints now that have the probiotic strains that the mouth really needs, just like we take probiotics for what our gut really needs. If you can add good bacteria to your oral environment, it will naturally then fight off the bad bacteria. So it's a really easy, great thing. Pop one in a day. Sorry, my dog just stop.
fine.
It's
I've
just
got
a
two locked up over here, so we never know. And the husband just
oral
walked in.
probiotics. Yes. If I'm really trying to treat gum disease and bleeding, I may pull out just for a period of time something like biocidin. I use a lot. They have a great dental line.
As we talk.
Yes. Biofilm buster naturally, botanically really hit some of those bad bacteria. It's not a forever thing. It's just a
Mm-mm.
treatment type of thing. That and colloidal silver rinses are
Yep.
really good
Yep.
at getting rid of some of the bad bacteria. And then, keeping things hydrated. I mean, we can go into vitamins and stuff. Those are so important. But the xylitol that I already mentioned, so gums and mints with xylitol. There's a saying called strive for five. So studies show if you can get 5 exposures of xylitol in your mouth a
Ooh,
day,
strive for
strive
five.
for five, that xylitol reduces strep mutans. So strep mutans are the bacteria that cause cavities,
That cause what?
cavities or
Oh,
decay.
okay.
So if you can drop your strep mutans level, then you're at less risk for getting cavities. So especially for, like, I don't see a lot of kids, but kids, pregnant patients, people that are cavity prone, try and get xylitol in your mouth 5 times a day throughout the day.
I will say I have two little funny little case stories to talk about there too. Is that I had a client come to me 6 or 7 years ago, beautiful big white smile, and she'd just been diagnosed with 11 cavities. She'd never had a cavity in her life,
Mm.
and osteopenia.
Oh.
Peel the layers of the onion back. Again, I'm a forensic nutritionist, like you're a detective dentist. She was eating a lot every day, raw spinach, kale, and chard, because she grew it. And those are mineral chelators. We like green leafy vegetables because they pull the minerals out of the soil, but they can also pull the minerals out of our teeth.
Interesting.
And so we had to get away from all that raw stuff. Case study number one. Number two, my mother, which is part of my why and why I'm in this practice, she did have Parkinson's, which was from a lifestyle of a lot of toxic exposure, but she loved coffee and sugar and pancakes and ice cream and cookies, and it was sugar. And people don't realize that that creates such an acidic environment in the mouth and in the body. And when you refer to the pH level, when we're so acidic, how do we buffer that? We use an alkalizing mineral, calcium. So she pulled all the calcium out of her bones, and her teeth completely fell apart, trying to level that pH. So that's, again, as we age, we want to be protective of acid levels, pH levels, what we're eating.
Yes. And I really get concerned when acid reflux is going on, or GERD,
Okay.
because I have seen so much dental erosion, and often that's silent and in somebody's sleep. And what's happening is the interthoracic pressure is building up in the gut and the stomach, and then that's coming up and regurgitating into the mouth.
Yeah.
And it just washes away enamel so quickly.
Oh boy.
So that is a red flag when I see patients that have this rampant erosion. It's, what are you eating? What are you drinking? Do you have acid reflux? Do you have a lump in your throat? Any kind of
Little
burning?
cough. Consistent
coughing,
cough.
tickling, clearing your throat, postnasal
Hmm.
drip. When we talk about like red flags that may need further testing, acid in your mouth is what is going on. That's a major red flag for me. I just, as far as a home remedy, baking soda. If
Hmm.
somebody is really going through a lot of acidic pH challenges in their mouth,
Hmm.
just taking a teaspoon of baking soda, maybe some sea salt and some water, and using that as a swish and gargle.
Yeah.
It will
Yeah.
immediately buffer and neutralize that acid in the mouth, and really can wash away a lot of that really quickly.
So my daughter-in-law, my daughter's 38, my daughter-in-law is 40 and starting to feel like she's feeling the hormone shifts. If you were in a room of 40 of women that were 45 plus, let's say, and they're all going, I got hormone shifts, stuff's going on. And because you said, you're 49, what would you give them as tips, advice? Hey, I've been here. This is my practice. These are the things to look for, just kind of into a nugget.
Well, they need a good hormone panel. I mean, it needs to be tested. Where are your hormones at right now?
Yes. And I can do that. So,
Yes, yes. I mean, so I think that's a starting point. And then mouth changes, being very diligent with your home care, making sure there's moisture in your mouth, that you're eating an anti-inflammatory diet. Sleep is critical.
mhm.
If there's any signs of mouth breathing, snoring, breathing is not good in your sleep, those are a big red flag that we need to check out.
Do you recommend mouth taping?
Yes, love it. If you can breathe through your nose, you have to
Yeah.
really be sure that you have a clear nasal passage or do a nose spray nasal clearing before bed, and then try some mouth tape. And do it at home while you're cleaning the house or cooking dinner, just to really get comfortable with it before you try and sleep all night with your mouth.
We have also studies shown that, and Dr. Bredesen will talk about this, that mouth breathing, not only does it shift the shape of your jaw and everything else going on, but that's one of the biggest indicators also for dementia.
Mm-hmm,
And so
mm-hmm,
another reason to say, okay, let's put that cute little tape on there and practice getting through our
mm-hmm.
nose. And
And my patients say that they sleep better. I mean, I do when I mouth tape, I totally sleep better.
yeah,
And
yeah,
when your mouth is open all night, your mouth gets dry. You wake up like your lips stuck
yeah,
together.
yeah.
Plaque accumulates. Gums get red and puffy and they bleed right in the front. I can always tell the pattern. You're a mouth breather.
Oh, wow. What's your favorite toothpaste?
So I like toothpaste that have hydroxyapatite.
Yep. Okay.
So my patients really prefer toxic-free type of options. So we're really getting away from fluoride for many reasons. So hydroxyapatite is a natural mineral that is good at remineralizing enamel, can help with tooth sensitivity, cavity control, enamel health. So it just needs more contact time on the teeth. So I tell patients, don't rinse it off right away. Let it sit on the teeth.
Oh, really?
Or
Okay.
if you do need to rinse off, take another layer, brush it or wipe it on your teeth and leave it. Or a
Okay.
lot of my patients that wear mouth guards or retainers to sleep, I say, okay, put a layer of the hydroxyapatite toothpaste on your teeth, slide your retainers in or mouth guard or sleep appliance or whatever
Uh-huh.
we're using.
Uh-huh.
So it's staying on your teeth as a protective barrier while you sleep.
Our favorite toothpaste, which was fluoride free, very strong peppermint, has gone out of business. And part of the a lot of these toothpastes like Risewell and I just found another one. They don't have the same. It's almost like the shampoo idea. Yeah, they don't have the same foamy kind of.
On purpose, because that foamy agent isn't good for us, Leslie. It's called sodium lauryl sulfate or
Right.
SLS.
Right.
And yes, a lot of people have reactions to that ingredient.
Mm-hmm.
So that foamy feeling, a lot of people will get burning around their lips and gums
Oh,
and
oh.
corners of their mouth, and there'll be a peeling of the tissue that happens. So I know it's not the same feeling, but it's actually better for you if it doesn't go.
It's a mindset. You're going to
I
make a
know.
decision. You're going to say, I'm making this choice for myself. I'm making this choice for my teeth and my smile. Get over it. It doesn't feel
Okay.
the same. You just have to do it.
But I do like Risewell. Boca is another one that's good. Dr. Jen's toothpaste has been a good one. So there's a lot of new ones on the market. It's really exciting to see that now we have more options
Isn't that fun? Oh, I love
than the
that.
standard grocery store versions that have
Yeah.
so many
I'm going to
like
check my
ingredients you can't read.
check in my
Pretty sure you
notes
can
here.
read
Just
your ingredients. Yeah.
make sure we've got, just to kind of recap, estrogen helps maintain our gum tissue because there's estrogen receptors in our gums, saliva flow, bone density. And as our estrogen drops, we notice this gum sensitivity, inflammation, dry mouth, maybe more cavities,
Mm-hmm.
jawbone loss. So, any woman who's from 40 plus, and if you've had a bad experience with a dentist, I did as a child. I'm a pastor's daughter, so we went to whoever was the dentist in the
Yeah,
congregation.
yeah, yeah.
I have to tell my audience, I love going to see Dr. Tevis. Her team is
Oh,
amazing.
thank
They're all
you.
very kind. We all nerd out on the science and they make you very comfortable. And Sarah's practice has the testing for your oral microbiome, for your, if you want a sleep study, see how your mouth is handling the breathing or the bacteria, and she can make recommendations. She can do whitening and straightening and all the things that, if, 45 plus is self-care. Maybe your kids now are at that 10 to 16 age and you've been running around with your hair on fire. You need to take care of, mom needs to be taken care of. If mom's not happy, nobody gonna be happy. And so
So true.
it's
So
it's
true.
all about what's happening in the mouth. Well, I just am so thankful that you were here today with me
Oh,
on a
thanks for having me,
Saturday
Leslie.
afternoon. We are going to turn this into I have a blog post coming out next week, I think, and all about this and referring to Dr. Tevis's practice and the ideas that we covered here today. This is also going to be made into a tutorial for my private membership. For those of you who are in membership, you get a new lesson or tutorial every month. And if you're in the DFW area, please look up Dallas Functional Dentistry. She can also be found on Instagram.
Yes, Instagram, Facebook. I need to get better at blogging. I'm going to start doing that more. But yes, and also I know we didn't touch on, but we do 3D CBCT imaging. So a lot of my patients come in and they're concerned about hidden infection in their mouth,
Okay.
especially with like the Bredesen protocol and things we really want to be sure we're not missing, say old root canals that may be going bad or infection in the bone that traditional x-rays cannot see. We can do a 3D scan of the mouth and really rule out other factors that may be going on. So just
That's so cool. That is really cool. Yeah, I do not have a root canal in my mouth. I don't think.
Good. We want to keep it that way.
I have a couple crowns, but that's it. I don't want any root canals. I did have my wisdom teeth pulled. I have a mouth that's this big. My mom had a tiny mouth. Everybody was like, "How do I get my fingers in your mouth?" Oh, just small mouth. But
it's fun. It's fun working with providers like you that really care and can help us figure out what's going on with our
That's
patients.
right. That's right. If your dentist says
the team, it takes a team.
It takes a team. It takes a village. And if you need to improve your diet, your nutrition, for all the things for good oral health, I'm your gal.
Love
All
it.
right. So I'm going to say goodbye and I'm going to just pause the recording.